So before we start, I want to review what is pain in the legs or symptoms in the legs due to venous insufficiency. So we're going to start with the Bond study. And the Bond study identified the most common symptoms associated with venous insufficiency in the leg. Leg heaviness, tightness, and itching. Oh, sorry. I'm a little too excited here. So we also know that venous insufficiency can cause pain in the leg. But this pain isn't stabbing or shooting pain. This pain is usually a dull, achy pain. We also know that this pain usually gets worse as the day goes on. And this pain can worsen if we sit for long periods of time or if we're standing for long periods of time. We also know that there's alleviating factors with venous pain. And those alleviating factors are ambulation, as well as leg elevation, compression, and massage. Let's start talking about non-venous pain in the legs that originates above the level of the legs. So any nerve that exits the spinal cord in the lumbar or sacral regions and innervates the leg has the potential to cause symptoms in the leg. So when we're developing a differential diagnosis for leg pain, it's very important to understand and learn our dermatomes in the leg. As we go down the spinal column, the innervation in the leg also goes distally. One common cause of neuropathic pain in the leg is sciatica. The sciatic nerve is made up of nerve roots L4, L5, and S1. Any inflammation, compression, or injury of these nerve roots is going to cause symptoms in the leg. If the L4 nerve root is affected, we're going to get lateral leg pain to the knee. If the S1 nerve root is affected, we're going to get posterior leg pain to the foot. Keep in mind that there's certain positions or there's certain maneuvers that can exacerbate these symptoms, which is a little atypical for pain due to venous insufficiency. Also, keep in mind that there tends to be weakness with neuropathic issues, and that's also a little bit atypical with venous insufficiency. If you have neuropathic pain, so pain or numbness, burning pain, that radiates from the buttocks down to the leg or down the leg to the foot, and it's bilateral, think spinal stenosis. Arthritis, disc herniation are common causes of spinal stenosis. Thigh pain, so we're moving down the leg now. Thigh pain, I want you to remember three things. Nerve, muscle, and bone. Okay, nerve, muscle, and bone. So nerve, just like the sciatic nerve, there's a femoral nerve, and it's made up of three nerve roots, L1, L2, and L3. It has an anterior and a posterior branch, and off those anterior and posterior branches, we have lateral and medial branches as well. Any injury, inflammation, or compression of any of these branches is going to cause pain in the legs. And actually, a common cause is neuralgia paresthetica. This is when you have compression or injury or inflammation of the lateral femoral cutaneous nerve, and you're going to get numbness and pain in the lateral and anterior proximal thigh. Piriformis Syndrome. The sciatic nerve runs either through, above, or below the piriformis muscle. The piriformis muscle is one of the muscles that makes up the gluteal muscle. So any compression of this nerve is going to end up causing pain that's similar to sciatic pain. It's going to cause shooting pain down the leg. The quadricep muscle is made up of a group of muscles. 4 muscles. We have the rectus femoris, we have the vastus intermedius, the vastus lateralis, and the vastus medialis. So any inflammation or pain or any inflammation or injury to this muscle group is going to cause pain in the legs. This pain, ironically, starts around the knee and ascends. So a lot of the nerve pain we see is shooting pain down the leg. A lot of pain due to the muscle groups is actually pain that ascends up the leg from the knee. When we see patients, I see a lot of patients that come in and say, after I sit for long periods of time, I get pain in my leg and it's hard for me to extend the leg. Think inflammation of the vastus intermedius, or nerve, muscle, bone. Think bone, arthritis. Arthritis of the hip can also cause pain and stiffness in the upper leg. Knee pain. The location of the pain gives you kind of clues on what's going on here. The most common cause of knee pain that is seen in a doctor's office is patellofemoral pain syndrome. And this is due to damaged cartilage right under the kneecap, and patients present with anterior knee pain. This is seen in athletic people. It's also called runner's knee. Jumper's knee is just a patellar tendonitis. Does anybody have ever heard of the duvet sign? The duvet sign is when patients come in and they say, I have to sleep with the duvet or a pillow between my knees because they're having inflammation of the fold of the synovial membrane in the knee, so they get anterior knee pain. Iliotibial band syndrome, we have a tendon that runs from the hip to the knee. This tendon can become inflamed or tightened, and that rubs against the thigh bone, and that causes lateral leg pain. Posterior, we see a lot of patients coming in for rule-out DVT because they have pain and swelling of the lower leg, and a lot of times the culprit is due to a Baker cyst in the posterior knee. Also consider injuries to the gastrocnemius muscle. Below the knee pain, medial tibial stress syndrome. This is another word for shin splints. Any muscle and tendon that becomes inflamed that inserts into the tibia in the medial shin is going to cause pain that runs up and down the shin. Compartment syndrome. We all know about acute compartment syndrome, but there's chronic compartment syndrome. Chronic compartment syndrome is also called exertional compartment syndrome. We see this in younger individuals. When they're exercising, they get symptoms of compartment syndrome, distal pain and numbness in the leg. You can also have shin splints not only on the anterior aspect of the lower leg, but also in the posterior aspect of the lower leg. Foot pain. Foot pain is usually not venous in origin. We have arthritis, many different types of arthritis: osteoarthritis, gout, rheumatoid arthritis, psoriatic arthritis. We also have tendonitis. So arthritis and tendonitis are two common causes of foot pain. The differential for foot pain is broad, so I just want you to know one word, and that word is podiatrist. So, you know, don't be shy and use your local podiatrist when patients come in with foot pain. The only thing that I want to talk about with foot pain is tarsal tunnel syndrome. If you have medial distal varicosities that's causing a dilation of the posterior tibial vein, this can put pressure on the posterior tibial nerve, and you'll get pain, weakness, and also numbness in the foot. All right, quick to wrap it up here, leg cramps. We know that varicose veins can cause leg cramps. We know that dehydration, electrolyte abnormalities, and increase in lactic acid in the muscles, sometimes side effects of medications can cause leg cramps. But we are a vascular practice, so don't discount claudication. Since we're a vascular practice, we should also know arterial issues. If you have a young patient that comes into your office with exertional leg pain, don't discount arterial issues. So we have to consider arterial endofibrosis. We also have to consider things like cystic adventitial disease, as well as popliteal artery entrapment syndrome. These are things we should all know and be able to recognize. And then if you do have patients that come in with multiple factors for atherosclerosis, depending on where the plaque is, can determine how this patient presents with pain. And on that note, I'm going to pass it over to Rick Kennedy. So thank you guys.